Hello friends, this is Dr. Krupa Savda and our today's topic of discussion is examination of rape victim. This is a very important topic. If you want more videos regarding forensic medicine, you can visit the description box. I have given all the links of all the playlists of my channel. So let us see the first part, that is introductory part. Doctors examining a victim of rape are soldiers with dual responsibilities. Firstly, they have to treat the patient and provide support. And secondly, they have to examine the victim and collect material evidence to felicitate and aid justice. So this is very important. The first part is the treatment part. So first they should treat the patient and they should provide the support, consolation. And the second responsibility is they have to examine the victim and collect material evidence to facilitate and aid justice. A female nurse or attendant should be present while examining the victim. And section 53(2) of CRPC states that whenever a female has to be reviewed, it should be done by a lady doctor. So a very important thing here in section 53(2) of CRPC, they have said कि जब फीमेल को एग्जामाइन करना है तो वो अंडर द सुपरविजन ऑफ लेडी डॉक्टर के अंडर ही करना है एंड अ फीमेल नर्स और अटेंडेंट शुड बी प्रेजेंट while examining the victim. The medical examination consists of recording of history, examination of clothes, physical examination and collection of material evidence. तो ये जो हमारा टॉपिक है उसको हम ये डिफरेंट 4 पार्ट में डिवाइड करेंगे. So for the recording of history, consent is very important. Written informed consent from a victim is a must. Without it, a doctor cannot proceed with a medical examination. So without consent, doctor cannot proceed with a medical examination. A victim over 12 years of age can give consent, and parent or guardian consent should be taken if she is a child under 12 or of unsound mind. So अगर 12 साल के ऊपर उसकी एज है तो वो कंसेंट दे सकती है. एंड अगर 12 साल से नीचे है या तो फिर वो अनसाउंड माइंड है तो जो कंसेंट है वो आइदर पेरेंट या तो फिर गार्डियन से लेना पड़ेगा बिफोर एग्जामिनिंग victim. Whenever, now let us go into the history. Whenever the victim has attended menarche, विक्टिम ने मेनार्की यानी कि जो उसका फर्स्ट मेंस्ट्रुएशन है वो अटेंड किया है कि नहीं. इफ यस, whether she was menstruating at the time of the alleged incidents. So ये जो है वो फर्स्ट क्वेश्चन होना चाहिए कि whether at the time of incident, whether on the time of alleged rape, whether she was menstruating or not. Her marital status and history. Obstetric history is if relevant. अगर कुछ ऑब्स्ट्रक्टिक हिस्ट्री अगर प्रेजेंट है वेदर सी इज प्रेग्नेंट और नॉट, सो ये चीज भी ऑब्स्ट्रक्टिक हिस्ट्री में उनको लेनी चाहिए. हिस्ट्री ऑफ एनी वेनरल डिजीज, वेदर सी इज सफरिंग फ्रॉम एनी वेनरल डिजीज और नॉट. हिस्ट्री अबाउट द इंसिडेंट, द टाइम, द लोकेशन, डेट, nature of assault and whether penetration was vaginal, anal or oral, and number of assilients. So whether it was a group rape or it was the assailant was only a single person. So it is also very important. Nature of assault, incident, time, and the type of penetration or the nature of penetration is also very important. Whether there was any ejaculation or discharge, whether resistance is offered or not. This is also a very important question because this might be a clue for some further examination. And is a bath taken or a local washing done? So all these questions in history should be asked and proper examination should be done. Clothes. Clothes should be examined for the presence of blood stains, semen stains, secretions, mud particles, hair और foreign materials. So जो कपड़े हैं वो blood stain, semen stain, secretions, mud particles या तो hair और foreign materials के presence है कि नहीं है उसके लिए उसका examination करना चाहिए. It is of utmost important to document any damage to cloth such as torn marks, cuts, tears, rips, wear and tear और loss of button. So कहीं पे भी कपड़ा फटा हुआ नहीं है, कोई कट मार्क्स है कि नहीं है, या तो फिर बटन लॉस हुए कि नहीं है, वो सब चीज के लिए जो है वो इट इज एन important to document all these things. Such damage can serve as crucial evidence indicating a struggle or the use of force in the case. So अगर ये सब चीज हुई है then it will be a crucial evidence कि वहां पे forcefully ये चीज हुई है या तो फिर during act कुछ struggle हुआ है. Microscopy can identify blood on the cut thread ends at a of a cut. So अगर ब्लड आइडेंटिफाई करना है कट थ्रेड में देन माइक्रोस्कोपी शुड बी डन. Physical examination and general examination. So for physical examination a good light is essential. So under a good light examination should be done. Record two identification marks, record general build, height and weight, record vital parameters. So all these are general physical examination. What in general physician should do: examine mental maturity about age and mental status, whether she is confused, clear or apprehensive. So these are the general examination which usually doctors do. Request the victim to stand on a significant clean white sheet of a paper and undress herself. So this is very important. A victim, doctor should request the victim on a significant clean white sheet of paper and undress herself. The purpose is to collect any material evidence that falls on the paper. So if something falls on the paper means it will be a material evidence and that should be collected. Examine the presence of any fresh or dried blood stains, semen stains or saliva stains on the body. This should be scraped, swept and collected. Not the presence of injuries over the body, and injuries may be most probably found over the face, neck, breast, inner aspects of thigh, and look for the recent physical assault injuries like grip marks, bite marks, and ligature impressions. So a doctor should collect all the swabs, whether it is dried or fresh, right? And injuries over the body कि फेस पे है, नेक पे है, ब्रेस्ट पे है, इनर एस्पेक्ट्स ऑफ थाई पे है, और रिसेंट फिजिकल असोल्ट इंजरीज लाइक ग्रिप मार्क्स, पकड़ने के कोई मार्क्स है, बाइट मार्क्स और लिगेचर इंप्रेशंस. Local examination. A good light again is essential and a lithotomy position is preferable. So the first one is pubic hair. Note whether shaved, unshaved or matted with semen or blood. This is very important. Search for the presence of any foreign hair. Take clippings of pubic hair from the victim for comparison. So यहाँ पे जो है comparison के लिए pubic hair should be taken. Clippings of pubic hair should be taken. Thigh. Note the presence of contusion or abrasions or any stain. Look for any vaginal bleeding. Labia majora and minora, note for the presence of any swelling, injury, stains, and soiling. So these four things are very important. Whether there is any swelling, injury, any stains, and any soiling in labia majora and minora, this should be known or this should be examined. Hymen, note the status of the hymen, whether torn or intact, and if torn, extent, position, whether it is freshly torn or old, right? Vagina, look at vaginal mucosa for the presence of any injury or foreign body. So here, vagina also should be looked for presence of any injury or foreign body. Rugae of vaginal wall, whether it is distinct or non-distinct, and look for vaginal canal and fornix for the collection of any fluid and semen. So vaginal canal should be looked for any collection like any fluid collection or any collection of semen. Samples should be collected in the victim. So clothes and undergarment, foreign evidentiary material like hair, fibers, button, etc. Fingernail scrapings should also be collected. scrapings from suspected stain marks on the body, right? This is also a very important sample. Scalp hairs, for the comparison will scalp hairs found over the body, clothes of the alleged accused, right? So scalp hairs also should be taken. Sometimes it should be helpful for comparison. Swab from teeth bite marks, combing of pubic hairs, hair clipping of victim as we have already mentioned previously, vaginal swabs, smears and cervical smears should be collected. So during examination, all this sample should be collected. This is very, very, very important. All the viewers should know this. Thank you for watching this video. You can subscribe this channel, click bell icon and share this video amongst your friends. Thank you.